Becky. I'm the PA at Ear, Nose, and Throat Consultants, and today we're going to talk about thyroid problems. There are a lot of people in our country that have issues with their thyroid, especially as we get older, and women in particular have thyroid dysfunctions. So what types of thyroid dysfunction do we actually see and treat here in our ENT practice? Well, first of all, things that you need to know about thyroid issues are the symptoms of thyroid disorders. The main symptom that usually brings people into the office, and this is to see their primary care most of the time, is fatigue. And if you're just excessively tired, then that will usually mean that you see your primary care doctor and they may draw labs. If they draw labs and your thyroid isn't functioning right, then that usually gets you put on thyroid medications. A lot of times that's all that needs to happen. But frequently, their next step then is that your family care practitioner may order some ultrasound of your thyroid just to see if there's anything going on. When that happens, then a nodule may be found on your thyroid, and that frequently gets you sent to see an ENT provider. So what do nodules mean? Well, nodules can be anywhere from so small, which is less than 1 centimeter, that we can't even get a biopsy of them, and most of the time they're benign anyway, to very, very large nodules, which cause symptoms of pressure and compression and difficulty swallowing and difficulty breathing. So it runs the whole gamut and can be anywhere in between. The ones that really aren't of any consequence are the ones that are really, really small. The only way we follow those is we just have your primary care provider check an ultrasound again in 6 months or a year. If they're stable over time, there's nothing that needs to be done with them. You just continue to watch them, you take your thyroid medication if you need to, and that's all that happens with the thyroid. So when your thyroid hormone is too low, then that's when you're called hypothyroid. You can also have where your thyroid hormone is too high, and that's called Graves' disease. That is a condition where your thyroid is overactive, and that's not something we typically manage in an ENT practice. That should be managed by your endocrinologist. So if you're thinking that you need to come see an ENT provider for that, you should actually be seeing an endocrinologist. It's usually managed with medication until your thyroid kind of gets regulated. Occasionally, you will see an ENT provider after years of having problems with Graves' disease and have to have your thyroid removed. But most of the time, it's manageable with medications. Another condition that's a thyroid condition is called Hoshimoto's thyroiditis. That's an inflammatory condition of the thyroid, and that's typically where the thyroid is attacking itself and kind of gradually burning itself out. And that's the most frequent cause of hypothyroidism, and that happens gradually over time. Again, that's not something that we manage in an ENT practice. So if you've been told you have Hoshimoto's thyroiditis, the best person to see is an endocrinologist for that as well. Now, if you have symptoms of pressure and compression, difficulty breathing when you lay down, you can't swallow, you look in a mirror and your thyroid, which sits right down here, is big, or one side of it looks big, then that's time that you need to see someone to get an ultrasound done of your thyroid. You can see your family practice provider, they can get that ball started. You can come in and see an ENT provider, and we can get that rolling. But that's the kind of disorder that we need to see an ultrasound on to see what the size of the gland is and if there are nodules in it. Nodules above a certain size just really need to be taken out, and we figure that's about 4 centimeters. 4 centimeters is a pretty good sized nodule. You're looking at something that's about that big, and that can put pressure on your trachea so that it makes it hard for you to breathe. It can put pressure on the esophagus, making it hard for you to swallow. And so because as they get bigger and bigger and bigger, that it just gets to be a much more difficult surgery, we prefer to take those out when they're smaller. The other thing that should happen is if you have a nodule that's over 1 centimeter, it should be biopsied under ultrasound guidance to make sure that there's nothing in there that looks like cancer. Thyroid cancer is not nearly as common as thyroid nodules because most of those are benign. However, we do find thyroid cancer, and then that leads to thyroid surgery, which will be discussed in another blog. But you just need to know what to watch for. The main thing is if you're just feeling excessively tired and you're feeling kind of slow and sluggish, see your primary care provider and get some labs checked and see what your thyroid hormone function is doing.